What is long-term care and why do I need to focus on it for my retirement planning? Today we're going to be talking about exactly just that. You're at the Parkmount Financial Partners YouTube page. So what is long-term care? Well, it's the risk that chronic disease, orthopedic issues, Alzheimer's, or just ordinary old age and frailty will restrict a person's ability to perform the activities necessary to carry out their daily living. And this could require a significant amount of financial resources and medical care that goes with it. And an example of this would be someone that is in need of additional support to dress themselves, to bathe themselves, to eat every day. And so they have to move to an assisted living facility or nursing home or adult daycare. Now, this care can be provided at home or by a family member, but that impact on that person can be quite significant. So some things to consider: 70% of people that are over the age of 65 will need long-term care in their life. 80% of that care is provided at home by someone they know and not in a professional scenario. Of those people, about 20 hours per week on average is required of them, which can affect them physically and financially. If they're still working, that can be a pretty significant burden. Less than 10% of adults age 65 or plus do have a long-term care policy. And to give some context around what a long-term care event might look like, on average for an adult male, it's about 2.2 years of long-term care that's required. For a female, the average is 3.7 years of long-term care event. And on average, the cost of that in a professional setting is over $80,000 per year. And that can vary significantly depending on the area of the country and also the level of care that is involved in that scenario. Now, addressing it is a critical aspect to protecting the people that you love and having too much of a burden on them, but also protecting your finances from the significant costs that might be associated with this long-term care need. And so how do we address that? Well, first, we need to understand the risks and costs associated with that. And then the client, whoever it is, needs to address how they want to be cared for, how they want that care to be delivered. And then they need to find out what resources might be unique to their situation that need to be considered. That could look like home equity. It could look like funds available. It could look like long-term care insurance or other insurance type policies, or even government programs available to help address these needs to pay for services. So let's talk about insurance. First of all, buying a long-term care solution is a possibility. On the large, we see the pricing for these policies to vary substantially. For people in their early to mid 50s, the pricing is more favorable. For someone in their mid to late 60s, it may be very hard to justify the economics of the situation, although it may be worth evaluating still. If someone does choose to purchase a long-term care insurance policy, there's other sub-decisions that they need to be made. Do they want to insure for inflation protection? Do they want elimination period? Do they want reimbursement or cash indemnification? So this is a very specialized area that after you make a decision to get a policy, you need to consider what's the unique structure for your situation. But the well-developed policy can help alleviate some of the stress associated with long-term care costs that might occur. The second area that someone might want to look at is government programs. The government is actually the #1 payer of long-term care services in the country. Medicare, which is the medical insurance program from the government for seniors, that actually does not cover almost all of long-term care. Medicaid is the program which covers long-term care costs, but to qualify for Medicaid, generally speaking, you have to be completely impoverished with no other assets to your name. If you're planning to use Medicaid, there is certain ways of protecting a small portion of your assets from being swallowed up by the government if you become reliant on the system there, but that would require the specialized attention of possibly a legal professional that is very familiar with those laws and rules in those areas. Additionally, there's different government programs for veterans to help cover some of these costs, and there's different state-based programs for long-term care partnerships where you can protect some of your assets from the Medicaid system if you pay for a policy sponsored by the state. Now, other areas of possible coverage that people choose is self-insurance. This can be a very effective approach if someone can appropriately estimate and provide for what that cost will be. A lot of times people might just figure, okay, well, hopefully my portfolio will grow without properly apportioning a piece of their portfolio to a contingency fund. Ideally, that contingency fund might look like a tax-advantaged Roth IRA so that your long-term care need doesn't cause a significant tax issue as well. Another way people might plan for this is with a hybrid life policy. If they have an existing cash value life insurance policy, they might be able to convert that to something that has long-term care benefits to them. Some continuing care communities offer different contracts that you can buy into to provide care at a discount if you're willing to pay a pretty significant upfront cost. So that there's no one-size-fits-all solution. Managing the cost of the long-term care that you might have in the future is a overlooked factor that looks like taking care of your health, getting regular exercise, taking care of your diet, and getting up-to-date medical checkups, having high-quality healthcare throughout your retirement so that it doesn't turn into a bigger issue down the road, and even making adjustments to your house to make it more livable as you grow into your later retirement years. This can be an extremely expensive issue and can really wreak havoc on someone's retirement portfolio. And so having a plan in place to address this risk is an important part of retirement planning. If you have questions about this or retirement planning in general, please feel free to get in touch with Park Mount Financial Partners. We would be happy to sit down and discuss your plan and different areas to consider. And even if you have questions about long-term care, we can help you evaluate which areas of your plan might lend itself to protecting against this sort of event. If you like this video, please hit subscribe to follow along for our future content. Until next time.